As an NHS trust, we're absolutely committed to eliminating all avoidable pressure ulcers.
So if we said, what is a pressure ulcer, how would you?
The first thing that was really important to us was to raise awareness amongst our own staff, and we provided them with a comprehensive training programme.
So you have your heels, your elbows, your bottom.
We have a very diverse workforce looking after our patients. So it's really important that nurses, doctors, therapists and assistants understand how they're going to work together.
As you can see, it's all covered in green with one little red piece.
So we have recruited some clinical champions right across the county, and they are key in motivating and enthusing the rest of their team and ensuring that people are having the right conversations to make sure that everyone is aware of how we can prevent pressure ulcers from happening.
Pressure ulcers, and to take part in our little quiz here to see how much you understand about what a pressure ulcer is.
The key to getting patients really motivated about this important issue is that having motivated staff who are able to talk to patients about the risks and explain to them and offer them good information and advice.
You've got your little leaflets here. Would you like to have a look through them?
We've also got some excellent leaflets and information that will support some of the education that we're giving patients on the spot. We have a number of inpatient settings where patients come in either directly from the community or from our acute hospitals, but our real challenge is the number of patients that we look after in their own homes across the community.
Okay, what have I brought you today?
So it's really important that our staff are able to promote good health and ensure that patients are taking care of themselves. From your audits, if you can capture some of the key things. We also have a small focus group that are part of a wider pressure ulcer collaborative at the Strategic Health Authority, and we talk to representation from care home providers, training and education departments, and we're looking at how we can support other people that come into contact with vulnerable people in the community.
You have to be careful then of taking too much pressure onto the hip bone.
I am 85. I had a pressure sore when I come here. They said that was very bad. I think that's all gone now, and I don't feel it at all now. The care I had was brilliant. I mean, I can get up here and I can walk down the corridor now. My advice is, you gotta help yourself. Not lay there or sit there. You gotta help yourself. They'll help you if you help yourself.
How are we doing against our ambition? Well, I've been watching the figures since the beginning of the year, but the numbers of avoidable pressure ulcers have reduced dramatically, and we know that that's a direct result from staff doing the assessments early on and putting some of the prevention measures in place for our patients.
Ow!